Every 40 seconds, somewhere on this planet, a human brain loses a battle it never saw coming. Before this video ends, several more people will collapse in kitchens, bathrooms, office chairs, grocery store aisles, and parking lots because a blood vessel inside the brain suddenly failed. Some of them will survive. Some will never speak clearly again. Some will wake up unable to move one side of their body, and some will never wake up at all. What makes this terrifying is not just how deadly stroke can be, it is the fact that in many cases, the body sends warnings nearly 24 hours before the major attack happens. Tiny disturbances, strange moments, symptoms people laugh off, ignore, or explain away with stress, fatigue, age, or dehydration. The dangerous part is that the brain rarely screams first. It whispers. And if you do not recognize those whispers, the next sound may be an ambulance siren outside your home. Most people imagine stroke as a sudden lightning strike. 1 second normal, the next second, disaster. But neurologists know something the average person does not. In a huge number of cases, the body gives clues before the major blockage finally cuts off oxygen to part of the brain. The tragedy is that people often experience these warning signs while fully awake and functional. They continue driving, continue working, continue scrolling on their phones. They wait for the symptom to disappear instead of asking why it appeared in the first place. That delay changes lives forever. To understand why these warnings matter so much, you need to understand something about your brain that most people never think about. Your brain represents only a tiny percentage of your body weight, yet it consumes enormous amounts of oxygen and glucose every second of your life. Even while you sleep, billions of brain cells are firing electrical signals, maintaining memory, controlling breathing, regulating heartbeat, processing emotion, and coordinating movement. Unlike muscle tissue, brain cells are extremely fragile when blood flow stops. If oxygen delivery is interrupted for only a few minutes, those cells begin dying permanently. Once that tissue dies, medicine can sometimes limit the damage, but it cannot truly reverse it. That is why doctors repeat the phrase, "time is brain." Every passing minute during a stroke destroys more living tissue inside the skull. What most people never realize is that the road towards stroke usually begins years earlier. Blood vessels become inflamed. Cholesterol sticks to damaged artery walls. Plaques slowly grow larger. Blood pressure weakens delicate vessel linings. Sugar damages circulation. Smoking thickens blood and injures arteries. Day after day, year after year, damage accumulates silently until eventually the system becomes unstable. Then one tiny clot, one sudden drop in blood flow, or one brief vessel spasm becomes enough to push the brain into crisis. Doctors have a name for the temporary warning episodes that often appear before a major stroke. They call them transient ischemic attacks, or TIAs. Many people casually refer to them as mini strokes, but that description can actually be misleading because there is nothing mini about what they predict. A TIA is often the brain's final warning shot before a catastrophic event. Blood flow briefly decreases in part of the brain, symptoms appear suddenly, and then disappear once circulation partially returns. Because the symptoms fade quickly, people convince themselves nothing serious happened. That mistake is one of the biggest reasons strokes continue destroying lives that could have been protected. Research has shown that the highest danger period after a TIA is within the next 24 to 72 hours. In other words, the body may hand you a narrow rescue window before permanent damage arrives. What you do during that window can determine whether you continue living normally or spend the rest of your life relearning how to walk, speak, eat, or remember your family's names. One of the most frightening warning signs is temporary blindness in one eye. People describe it in different ways. Some say it felt like a dark curtain sliding over their vision. Others say everything suddenly became gray, foggy, or distorted. It may last only seconds or a few minutes before normal sight returns. Because the symptom disappears, many people blame exhaustion, standing up too quickly, migraines, or too much screen time. But what may actually be happening is far more dangerous. Tiny clots or fragments of plaque can temporarily block the artery feeding the retina. The retina is extremely sensitive to oxygen deprivation. Even a short interruption can create sudden darkness. When blood flow returns, vision clears again. The terrifying reality is that the same clot causing temporary blindness could easily travel slightly farther and block a major brain artery next time. Neurologists treat sudden, one-sided vision loss like a fire alarm because it often means unstable plaque already exists inside the carotid arteries of the neck. Those arteries are major highways delivering blood directly to the brain. When plaque becomes fragile, small fragments can break loose and travel upward through circulation. Sometimes the eye becomes the first warning target before the brain itself suffers catastrophic injury. Hospital records repeatedly show the same tragic pattern. A person ignores several brief vision episodes because they recovered quickly. Days later, the major stroke finally arrives. Another common warning sign is sudden numbness or tingling affecting one side of the body. This can involve the face, hand, arm, leg, or an entire side. People often describe it as pins and needles, heaviness, weakness, or a strange disconnected feeling, almost like the body part no longer belongs to them. The key detail is how suddenly it appears. One moment normal, the next moment something feels profoundly wrong. Then, just as quickly, the symptom fades away. Many people confuse this with sleeping awkwardly on a nerve, but true stroke-related numbness behaves differently. It is not caused by posture or pressure on the limb itself. The problem originates inside the brain regions responsible for sensation and movement. Since each hemisphere controls the opposite side of the body, stroke symptoms usually appear asymmetrically. Sudden one-sided numbness is never something intelligent people should casually ignore, especially when it appears without explanation and disappears on its own. The third warning sign can feel almost unreal when it happens because it attacks something most people completely take for granted: balance, coordination, the ability to walk through a room without thinking about it. A person may suddenly feel as if the floor shifted beneath them. Their leg lands awkwardly, their body drifts sideways. They grab a table or wall for support, even though they are standing on perfectly level ground. Some describe it as feeling drunk despite having consumed no alcohol at all. Others experience a violent spinning sensation that appears without warning while sitting still or walking normally. Then, after a few minutes, the sensation fades and life continues. That temporary recovery is exactly what makes these warning signs so dangerous. The back portion of the brain contains structures responsible for coordination, posture, and spatial awareness. One of the most important is the cerebellum, a region constantly calculating how muscles should move together so that every step feels smooth and controlled. The cerebellum relies on uninterrupted blood flow from arteries running through the neck and into the back of the skull. If circulation suddenly drops, even briefly, the system begins malfunctioning. Movements become clumsy. Balance disappears. Vision may feel unstable. Walking can become unpredictable. People commonly dismiss these episodes as dehydration, exhaustion, low blood sugar, stress, or an inner ear problem. Sometimes those explanations are correct, but spontaneous balance disturbances with no obvious trigger should never be treated casually, especially when combined with other neurological symptoms. Doctors often discover later that what patients thought was dizziness was actually temporary oxygen deprivation inside the brain itself. Speech problems create another major warning sign that many people misunderstand. Everyone occasionally forgets a word or loses their train of thought when tired. That is normal. Stroke-related speech disturbances are completely different. The breakdown feels sudden, abnormal, and deeply alarming. A person may know exactly what they want to say, but cannot force the words out correctly. Sentences become slurred, fragmented, or strangely slow. Sometimes speech sounds confused or nonsensical. Family members may notice it immediately before the person experiencing it even realizes something is wrong. Inside the brain are highly specialized regions dedicated to language production and comprehension. These systems require enormous precision. Tiny interruptions in blood flow can disrupt communication between thought and speech within seconds. One area may fail to organize words properly. Another may fail to understand language itself. In some cases, a person speaks fluently yet produces meaningless sentences. In others, they fully understand conversation internally but cannot physically express the words. What makes transient speech problems especially dangerous is how quickly people rationalize them afterward. They blame stress, fatigue, anxiety, lack of sleep. But the brain does not randomly lose language function for no reason. Sudden speech breakdowns that appear and disappear are among the clearest neurological red flags doctors watch for before major strokes occur. Then there is the warning sign that frightens neurologists perhaps more than any other because of how often people ignore it completely. Sudden weakness affecting one side of the body. Not ordinary tiredness. Not soreness after exercise. Real weakness. A coffee cup suddenly feels heavy. A leg drags slightly across the floor. A hand struggles to grip objects properly. Buttons become difficult. A person notices their smile looks uneven in the mirror. Sometimes family members notice facial drooping before the individual recognizes it themselves. These symptoms occur because specific brain regions control voluntary muscle movement through electrical signals traveling down the nervous system. When circulation drops, signal transmission weakens or stops entirely. Muscles that normally respond instantly become slow, clumsy, or partially paralyzed. The terrifying part is how rapidly these episodes can progress from temporary warning signs into permanent disability if the underlying blockage finally becomes complete. There is another detail stroke specialists emphasize constantly because it saves lives when recognized early. Stroke symptoms are usually sudden. That suddenness matters enormously. Gradual symptoms developing over weeks often point toward different medical problems. But a stroke-related event tends to feel abrupt, almost like a switch flipped inside the body. 1 second, everything functions normally. The next second, something is obviously wrong. The body also gives clues through unusual headaches, especially headaches that feel dramatically different from a person's normal pattern. Not every headache signals danger. Millions of headaches occur from stress, tension, dehydration, sinus problems, poor sleep, neck strain, or migraines. But neurologists become concerned when someone experiences a severe, unfamiliar headache combined with neurological symptoms like numbness, weakness, dizziness, or visual disturbances. Blood vessels inside the brain are incredibly sensitive structures. When circulation becomes unstable, arteries narrow, or pressure changes suddenly, the nervous system reacts aggressively. Some people describe these headaches as explosive. Others describe deep pressure, stabbing pain, or intense throbbing unlike anything they previously experienced. The important point is not to self-diagnose every headache as a stroke warning. The important point is understanding that sudden neurological symptoms paired with unusual headaches deserve urgent medical attention rather than passive observation at home. One reason strokes remain so deadly is because people misunderstand risk. Many assume stroke belongs exclusively to the elderly. While age absolutely increases danger, hospitals continue seeing younger adults suffer strokes every single year. High blood pressure, diabetes, smoking, obesity, chronic inflammation, autoimmune disorders, heart rhythm abnormalities, drug use, sleep deprivation, and extreme stress are damaging younger blood vessels far earlier than previous generations expected. Some people believe normal cholesterol numbers guarantee safety. They do not. Others think exercise alone protects them while ignoring blood sugar, smoking, or uncontrolled hypertension. Stroke prevention is never about one single number. It is about the overall health and stability of the vascular system feeding the brain every second of every day. The frightening truth is that many people walking around today already carry silent plaque inside their arteries without realizing it. The process develops quietly over years. No pain, no dramatic symptoms, just gradual damage accumulating beneath the surface until one day the body finally begins whispering warnings before the major collapse arrives. What makes stroke so cruel is that the damage often happens quietly while a person still feels mostly normal. Someone experiences numbness for 3 minutes and continues shopping. Someone loses vision briefly while driving and decides they are simply tired. Someone struggles to speak clearly during dinner, laughs nervously, drinks water, and moves on with the evening. Meanwhile, inside the arteries feeding the brain, the real disaster is still building momentum. Doctors who treat stroke patients see the same heartbreaking sentence repeated constantly. I thought it would pass. And sometimes it does pass for a few minutes or a few hours, but temporary recovery is not safety. It is often the final warning before permanent injury arrives. The body rarely wastes energy creating neurological symptoms without reason. When blood flow to the brain becomes unstable, the nervous system reacts immediately because survival depends on oxygen reaching those cells continuously. One of the most dangerous times for stroke is during sleep or the early morning hours. Blood pressure naturally falls overnight. In healthy arteries, this usually causes no problem. But if a vessel is already narrowed by plaque or partially blocked by unstable clot formation, reduced nighttime circulation can become enough to completely shut blood flow down. That is why some people go to bed feeling mostly fine after strange warning episodes, then wake up unable to move an arm, unable to speak, or unable to recognize the faces around them. There is another reason these warnings deserve serious attention. Modern medicine can often reduce stroke risk dramatically when doctors identify the danger early enough. Imaging tests can reveal narrowed carotid arteries before total blockage occurs. Heart monitoring can detect dangerous rhythm abnormalities, sending clots toward the brain. Blood tests can uncover uncontrolled diabetes, silently damaging circulation for years. Blood pressure treatment, smoking cessation, weight control, glucose management, and properly supervised medications can all lower the chances of catastrophic brain injury. Prevention may not sound dramatic, but prevention is the reason some people continue living normal lives, while others spend years trapped inside damaged bodies, wishing they had acted sooner. If you ever experience sudden one-sided weakness, facial drooping, speech problems, temporary blindness, severe unexplained dizziness, or abrupt coordination loss, do not sit alone hoping the symptom disappears forever. Do not drive yourself while neurological symptoms are happening. Do not search social media trying to diagnose yourself. Time matters more than pride, embarrassment, or denial. Even if symptoms fade completely, the safest decision is urgent medical evaluation because the next episode may not disappear again. The most important thing to understand is this: stroke is not always random. In many cases, the body gives warnings first. Quiet warnings, brief warnings, warnings easy to dismiss until life changes permanently. Knowing these signs will not make you fearful. It makes you dangerous to the disease before the disease becomes dangerous to you. The people who survive stroke with their speech, memory, independence, and movement intact are often the people who respected the early whispers before the brain was forced to scream.